Hi, Dr. Michael Ryan, answering the question, what kind of doctor should I see for a vein condition? And really what you want to do is go to a specialist that is focused, at least part of their practice, on treating vein conditions. That allows that individual, that provider, to have developed enough experience diagnosing a vein condition and treating it to be able to sort out what your condition is and make recommendations to you. Generally speaking, a specialist could be in family medicine, internal medicine, radiology, vascular surgery, cardiovascular surgery, cardiology, interventional radiology. All of those are individuals that have uh, transitioned over to incorporate vein treatments into their practice. The one thing you want to do is find out, are they actually doing it on a regular basis, or is it once a month or once every 3 months? Because you want to see someone that is doing it on a regular basis. That is at least several times a week. Uh, that allows them to have enough what we call pattern recognition in medicine, being able to recognize the patterns of the condition, and also be able to recognize who would benefit from treatments, and then have enough volume to develop their skills and maintain their skills in treating the patient. So any of those are acceptable. You just want to find out who's got a reasonable amount of activity, and you can ask the team when you call them, how often do they do vein treatments, how many days a week, and you can ask them how many treatments a week are they doing. They may or may not share that with you, but they may tell you how many days a week they're doing treatments, and that can give you an idea of, is this a clinic that you want to go to. Another skill set that does help, and this is my opinion, is skill in ultrasound imaging. Not every practitioner has developed skill in ultrasound imaging, but ultrasound is the the most important tool in not only diagnosing a vein condition but in treating it. And you have the ultrasound, which has got a little probe that you run over the skin with gel, just like women that have an ultrasound before their delivery. You can look inside and see these veins clearly, and it's a remarkable advance. And this is one of the two things that has been responsible for the advance in treatment of vein conditions, is the proliferation of ultrasound in the office. If you're relying on your ultrasound technologist, that can also be practical and work, but the person that is actually doing the treatment, that is able to look with the ultrasound machine themselves, is, I think, going to have an advantage and a higher level of skill at telling you right on the spot, this is what you need, this is your problem, without having to get another person that would be the ultrasound technologist to come in and interpret and look around and help make the decision. So, in summary, I think there are many options out there. You want to find someone with experience, and ideally someone that has ultrasound experience. And often that means they may have a additional credential as an ultrasound technologist, or RVT, or they are skilled and qualified to interpret ultrasounds. Those are also qualifications that would benefit in a vein care practice. So, Dr. Michael Ryan, answering the question, what specialist treats vein conditions?